From KARK4 and Fox 16, this is a special report. Here's Mitch McCoy.
And good day to you from Studio B here in Little Rock. We are moments away. Governor Asa Hutchinson will be providing a COVID-19 briefing. This as ICU beds are quickly becoming difficult to find in the state of Arkansas. At last count, early this morning, the Arkansas COVID-Com system, the state system responsible for tracking ICU beds and hospitalizations across our state, reporting only one ICU COVID bed available in the state of Arkansas. All of this while COVID-19 cases continue to climb in our state. Good afternoon to you. I'm Mitch McCoy from Studio B, where we are continuing to track some of these COVID-19 numbers, and the cases are starting to mount. We are expected to hear from Governor Asa Hutchinson in just a few moments, but I want to welcome in our viewers both online and across all of our digital platforms, also those that are watching on TV. You're looking live right now at Arkansas State Capitol, where the governor will be providing this briefing in just a moment. Late yesterday, the governor announced that there were only 8 ICU beds available across the state of Arkansas. That is the lowest number of ICU beds available in our state since this pandemic began. Late this morning, we heard from Arkansas COVID-Com, as I just mentioned, only one ICU COVID bed available. So we're expected to hear the governor give us an update on the number of ICU beds that are available across Arkansas. It's worth noting that there were multiple records broken yesterday across the state in terms of hospitalizations. Not only did Arkansas see the largest single day increase of hospitalization since the pandemic began, Arkansas surpassed the winter surge in terms of the total number of hospitalizations across the state. 1,376 at last count were the number of people inside of an Arkansas hospital. It's also worth noting that the number of Arkansans on a ventilator has surpassed not just one record, but 2 records this week. And so we will be hearing from Governor Asa Hutchinson in just a moment. If you're just joining us on our digital platforms or on television, you're looking live at the Arkansas State Capitol, where Governor Asa Hutchinson will be providing a briefing any moment now, where we are expected to get an update on COVID-19 across the state of Arkansas. Not only are cases rising, the number of hospitalizations have shattered records this week, and there's a lot of eyes on the state of Arkansas. Not only are we expected to hear the governor talk a little bit about the hospitalizations, we could hear the governor talk a little bit about masks, specifically masks in schools. We have heard growing pressure not only on school officials, but growing pressure against people who oppose masks in schools. But the stark reality right now, according to the Arkansas Department of Health, is that there are more and more younger people being admitted into hospitals right now across the state of Arkansas. And we have heard that time and time again from Dr. Jose Romero, along with other health professionals, including Arkansas Children's Hospital. Again, you're looking live there as we continue to wait and monitor. We're waiting at live pictures here, watching the governor's official channel here. The news conference has not started, but we are expected to hear an update in just a moment. Late last night, we got word from Baptist Health CEO Troy Wells that there were a number of ICU beds filled across his hospital, including no ICU beds available for most of the day yesterday. Let's listen in to Governor Asa Hutchinson. He's providing this COVID briefing right here live across KRK and Fox 16 platforms.
Weekly update, and I'm pleased to be joined by Dr. Jose Romero of the Department of Health, Secretary Johnny Key of the Department of Education. We have Don Steele with the Department of Human Services, and I want to thank you for their participation, each of you. Let's first start with the case report I want to review, and then we will go through a couple of announcements and comments today, and we have a number of things to cover. But let's first look at the case report over the last 24 hours. As you can see, we went up another 2,620 cases, which is a little bit higher than a week ago. and active cases up. Total deaths is very sad to see 24 additional Arkansans that have succumbed as a result of COVID-19. In terms of the hospital data, we see again that we have 59 increase. Yesterday it was 103, today it's 59. Certainly it reemphasizes the stress upon our hospitals. 8 new on ventilators, even though we do have sufficient ventilator capacity here in Arkansas. You can see the numbers by the 3 leading counties. Our testing is continued to be significant simply because people are asking for it, and it's a result of the risk that they see in the state. In vaccinations, again, we had a very strong day with 11,000 doses that were given yesterday, and the significant fact that I've been looking at for a long time is we crossed the 1.1 million mark for Arkansans fully immunized. And so that was encouraging us to see. We actually had 4,380 that have been fully immunized. And so that's the case report. If you go to the next one, we can see a couple additional pieces of information. This is the percent of active cases 18 and under. And this starts January 11th through August 10th, and it gives us some comparative data. And so you can see last year, 2020, so right at a year ago, 12% of our cases, active cases, were 12 and under. And then in January 11, we were still dealing with the virus, but it's 14%. But with the new Delta variant, you can see it's 19%. And that is a factor that is important for us all to recognize. Next, you'll see the breakdown of those that have been vaccinated and not vaccinated in terms of cases, hospitalizations, and deaths. The Department of Health adjusted the data based upon questions and feedback to make it more representative. And so last week it was January, but the vaccinations really weren't out significantly then, so we moved the date forward to February to give it a more accurate representation. And so in cases, 8% I'm going to go a different way, right at 92% of all the cases have not been fully vaccinated. Of the hospitalizations, it's 93% have not been fully vaccinated. And in terms of deaths, right at 92% have not been fully vaccinated. If you go to the next slide, you will see just simply where I keep looking for a breaking point where we might start going down again. And even though there's been some national predictions on that, we just don't see it in the data yet. You can see that we continue to increase week after week in our cases. And so with that, let me focus on one particular issue today, and that is our Medicaid beneficiaries and their vaccination rates. The fact is that we took a close look at this, and our Medicaid beneficiary vaccination rates are very low. In fact, only 27,000 traditional Medicaid clients aged 12 and up have been vaccinated. Now, to put that in perspective, we have 627,000 recipients on traditional Medicaid, and that means that 4.3% of traditional Medicaid recipients are vaccinated. That is extremely, extremely low in a very vulnerable and at-risk population, and it's a challenge for us. We have to do better for this vulnerable population, and you can see with the distinction really between a state like Arkansas that has a high Medicaid population versus some of the states in the Northeast has higher vaccination rates, but they have lower Medicaid population rates. And so this is something we've got to work on uniquely in our state. And so one way to improve these numbers and outreach is to encourage more physicians to engage with the beneficiaries on the vaccines and to answer questions, consult with them at length, and to encourage vaccinations as these beneficiaries will go into the physician or provider's office. Today I'm announcing that Arkansas will be increasing the COVID-19 vaccine administration reimbursement rate for physicians from $40 to $100. This will be for the 2 doses of Pfizer and for Moderna and the 1 dose of J&J. I am asking all providers who serve traditional Medicaid clients to reach out to those who are not vaccinated, offer counseling to them, answer any questions about the benefits of the vaccination, give them the medical information that they need, and it is going to be billable to Medicaid. This, if we get the word out sufficiently, and Don has taken the lead in this and will be communicating with our physician groups, our provider groups, to encourage their understanding of this. They're reaching out to our Medicaid clients and that they will come in and get this counseling, and it's an incentive obviously for the physicians because of the not just the good it will do, but because it's a very healthy reimbursement rate that we're increasing it to. Secondly, I want to talk about education as we get ready for school. I asked Secretary Key to get us a marketing program, an initiative ready for going back to school and increasing vaccination. So I'm pleased to announce that they have adopted Stop the Hesitation, Get the Vaccination program for our schools, and they will be working closely with our schools to increase the number of clinics that they have, to encourage this with marketing tools throughout the state to encourage continued vaccination of those that are 12 and above. And then secondly, we're looking at a supply of high efficiency filtration masks that we can make available for the schools. And I recognize that the schools are making different decisions, and that's the prerogative they have, but regardless of whether they have a mask mandate in the school or not, there's going to be children that come there that need masks, that maybe they got rid of their masks last year. We want to help the school districts have an adequate supply of that, particularly the high efficiency filtration mask, and we hope that that will be available before school or soon thereafter. We're working very hard to get that supply ready. And so with that, I have some other comments, but I got a feeling you might be asking questions that will lead to those. And so let me ask Dr. Romero if he'll come and make his comments, followed by Secretary Key.
Thank you, Governor. So let me give you a quick update of immunizations of individuals 12 to 18 years of age. So at this time, we have 58% of that population has received a single dose, and 36% has received a single dose, and 20% have received a full dose, full immunizing series. It's important to note that these children are at risk, that we are seeing significant increases in the number of individuals within that age group and younger hospitalized, and that the protection really is for the 12 to 18-year-olds. For individuals younger than that, it's very important that they be encouraged to wear masks when in public, and specifically when they go to school. We've already had an outbreak in one school district that continues to increase in number, and we can foresee that happening as we move forward into the school year without proper masking. Thank you very much.
Today, the Department of Education released updated guidance for schools through the Ready for Learning guidance mechanism, and that the changes there reflect the changes that the CDC made just shortly after we released our original guidance 2 weeks ago. But our guidance reflects their guidance. We've vetted it, worked with the health department to make sure that it is aligned. And that change is simply about the mask and face covering recommendation for all students in the schools. It is a recommendation, certainly is not a mask mandate, but we are also making sure that schools are aware of the current status of the court case in Judge Fox's court. As the governor said, we're also launching a vaccination campaign to encourage those students that are eligible to get that vaccination. And I'll give you an example I heard today. A medical provider was having a conversation last week with a student. He was a football player. He was 14, and she asked, "Would you like to get the COVID vaccine?" He said, "No, Doc, I'm good. I really don't think I want that." And she continued the conversation, and she got his football schedule, and she said, "Well, let's just look at this. If you become a positive case, it's 2 weeks, and then here are some other games you're going to miss to make sure that there are no long-term medical issues that we need to follow or we need to follow up on." And at that point, after understanding the impact that that would have on his football season, he decided, you know what, I think this is a good idea. I probably do need to get the vaccine. Those are the conversations that we are encouraging local medical providers to have with your students, with the parents in your school district, and we're encouraging district leaders to actually bring those medical providers in, those local trusted voices, so they can have those conversations and answer whatever questions that parents and students may have.
Thank you, Johnny, and with that, we'll take any questions.
2 questions. One to ask you about the ICU capacity. What's being done right now to address just the lack of ICU space that we've seen so far? And also, second question, I want to ask you about the status of the Fox ruling, your response to it. Have you talked to the AG about it? Are you still looking at retaining outside counsel to have your own voice in that case?
First, on the ICU beds, we're watching that very carefully, and we're taking action. And so we first worked with the Hospital Association to free up additional space with beds, which means that they're having to really monitor the other acceptance of healthcare needs and to make sure that they have adequate ICU beds available. Secondly, as you know, and I want to applaud the General Assembly for their support of the request for American Rescue funds to be used for staff expansions that will open up additional ICU beds. And so through specific hospitals, we're opening up additional beds that will be available for COVID patients, as well as providing funding for staffing. And then, as you know, we did have a team from HHS and FEMA to come in and evaluate our hospital situation to see if we're missing anything. And so we are working with them. I've got information from them. We're trying to implement some of the suggestions that they have put into place. And so a lot's happening in that arena to make sure that we can look ahead and get ahead of the curve on ICU space. It is obviously very limited. I believe yesterday we had 8 ICU beds that were available. Today it is just a few more than that, but it is still very, very close. And the same thing is true with Children's Hospital, that for their pediatric patients, they have a slim margin. They do have some space, but that's one of the things we've got to work both to reduce the cases and the exposure, but also to plan ahead because it looks like we're going to have pressure on the hospitals for some time. In terms of Judge Fox's decision, I have advised the Attorney General's office that I will be seeking outside counsel for that. And let me emphasize, the Attorney General has always provided the best level of representation for me. She has a responsibility to represent the people of Arkansas. It's just that there's an inherent conflict here that's unavoidable. So I will be seeking counsel that will be able to represent my views on that case as it proceeds. Right now, we do not know what action the Attorney General will take as to whether there will be an immediate interlocutory appeal to the Arkansas Supreme Court or whether they'll go to a trial on the merits. I don't know yet, but under either circumstance, I will be retaining individual counsel to represent me in my official capacity, and you'll have more information on that as that develops.
Now that Act 1002 is not in effect, what's the reason for not implementing a statewide mask mandate? And short of that, would you encourage businesses and cities, other people to require masks?
No, I've said very clearly I do not support a statewide mask mandate. I don't know of very many governors actually that are moving that direction. And the reason is that we want the focus to be on vaccinations. That is the way out of it. Now, CDC has recommendations that we have adopted here at the state that do recommend mask wearing in indoor space, whether vaccinated or not. That's with the Delta variant, that is the level of protection that is a recommendation that we have. But we're not going to put in place a statewide mask mandate, and with the Judge Fox's decision setting aside Act 1002, which I support, it gives local jurisdictions, including schools, that option. And I think that puts us in the right position because it's not a statewide necessity now. You look at it area by area, the recommendations are there, and the concern I've always had are those that are 12 and under that do not have a vaccine available to them, and that's the reason I wanted 1002 amended so that the schools can have the option to protect that age group.
It sounds like you don't have any objection to like cities or other entities that want to require masks if they want to do it.
Well, they have the independent authority to do it. I'm not in favor of it. I am in favor of the schools exercising that option, and I applaud many of them for taking those steps. But I think at this point the mask mandate is not something that is a useful tool. People know what they need to do. They have the guidelines in place, and I think it is obviously it's their prerogative, but it's not something that I'm pushing.
Back to the surge response team that came here to address the hospital situation, are you able to divulge any of those suggestions that they gave to address this problem?
Well, a number of the suggestions that they made, we've either implemented or already in the process. Now, that doesn't diminish the report, but for example, one of the recommendations that they made was on reference to monoclonal antibody administration, that they wanted us to make that more available through the hospitals. They see that it is limited, that many of the hospitals or facilities are not pushing that out, which it is such a great therapeutic. And of course, if that's successful in an outpatient clinic setting, then that's going to free up space. So that's one of their recommendations. Well, simultaneously with that recommendation, we had approval of use of American Rescue Plan funds to give our hospitals $1,000 per licensed bed to encourage administration and offset costs for use of monoclonal antibody administration. That cost $9.6 million. So that's just one example. Now, there's others that I would look at more carefully, but that's the only one that I can really recite as a very specific point that we are trying to address.
You've been listening to Governor Asa Hutchinson address COVID-19. There are a few more ICU beds available than yesterday. The governor citing that we have shattered another record in terms of hospitalizations across the state, now more than 1,400 in the hospital right now as new cases, active cases, hospitalizations, and death increase again today. For our viewers joining us on TV, you can continue watching Governor Asa Hutchinson's address on KRK.com or Fox16.com. For viewers that are watching online, stay right here. We'll get back to the governor in just a moment. For now, I'm Mitch McCoy. This has been a special report from KRK4 and Fox 16. For our viewers that are sticking with us online, let's continue listening in to Governor Asa Hutchinson.
The space is limited. Dr. Romero, did you want to say anything more on that?
For Secretary Key, I know that the Department of Ed changed their guidance about mask wearing to align with the CDC, but do you personally agree with Judge Fox's decision to allow schools to issue this mask mandate?
Well, I think one thing I've learned is to avoid trying to opine on what judges think and don't think, because it's a preliminary temporary order. At this point, there's a lot that's going to take place in those proceedings. I think our focus right now is to help make sure schools make the best choice for their local school district, and helping them, guiding them as they go along those decision-making processes. We want to assist them. We want to have a successful school year. If they choose masking as one of the multiple strategies to that, then we're going to support them in that effort.
For Mr. Keith. I was wondering if you can give me some more details of sort of what the campaign is going to involve. Is it going to have presentations that will be done in schools, or is it going to have teachers have the responsibility to suggest these things to students, things like that?
Well, I think it's going to be a continuation of many of the things that we have already engaged in and the health department has engaged in. I think we will see a number of social media efforts targeted to our student population, especially those that are in the 12 and up category. Also providing information for parents so that they understand better. One of the questions we get concerning the vaccine is about the safety of the vaccine. Well, the technology of the Pfizer vaccine has been under development for a number of years, but that's not information that parents have readily available. And when they do get it, it's in very technical medical terms. We want to try to boil this information down into terms that everyone can understand and create confidence in the efficacy of the vaccine.
Let's go remotely to see if there's a question.
Hey, Governor, this is Chelsea Helms with KNWA in Fayetteville. I have two questions for you. My first is President Joe Biden had encouraged states to offer a $100 incentive to those who aren't yet vaccinated. Is this something that Arkansas is considering doing? And then my second question is ACHI issued a release today ultimately saying schools should consider pushing back the start date. Is this something that you think should happen? What's your reaction to that overall?
First, in reference to an additional incentive, we look at every option as to how we can increase vaccination rates. My experience has been that the incentives have not worked very well in terms of the general public. They do work well in terms of the workplace, including state employment. We did offer an incentive that has borne success, and so we'll continue to look at it, but at this point we have no plan to implement additional incentives in reference to the general population. Secondly, in reference to ACI's recommendation that school be considered to be delayed, I'm not in favor of that. I've discussed this with both Secretary of Education and Dr. Romero, and whether you delayed it 2 weeks, all you're going to do is you're still going to be left with 12 and under not being able to be vaccinated, so that challenge is still there. You're still going to be faced with low vaccination rates, even though we hope to improve those. And so we don't see any advantage by delaying school. People are planning on that. Everything is geared toward that, and we cannot risk another year of school. We have to get off to a good start. We want to stick with the date that has been planned and do everything we can between now and then to make it a safe environment.
Governor, this is Benjamin Hardy with the Arkansas Nonprofit News Network. I have two questions, actually. First, when you say you're working with the Hospital Association on ICU space, has that involved any adjustments to nurse or respiratory tech staffing ratios in ICU, or any adjustment to the standards that hospitals are using to admit patients to the ICU? And then the second question is about the figures you gave regarding the vaccination rates among traditional Medicaid recipients. I wonder if that's inclusive of nursing home and other long-term care residents, and if there's evidence that nursing home residents on Medicaid are being vaccinated at a lower rate than other nursing home residents. It just seems like a low number considering a lot of nursing home residents have received the vaccination.
All right, what was your first question again?
My first question was about whether there's any adjustment to nurse or
to the ratios, and the answer is that flexibility is already available for our hospitals, and so they have flexibility under laws that the legislature passed. So I don't see any impediment there. They're making adjustments as needed. And then in terms of the second question, I'll ask Dawn Steele if she'd come and address that.
Yeah, so in terms of the 27,000, that represents what we consider our traditional Medicaid population, which is largely children. It also includes women, and then some of our disabled populations like long-term care. We also then have populations that are served through our PASS program and through our Arkansas Works program, but those are different. They have different programs through which they're served, but yes, for this population, we know that it does include long-term care residents, and we know that there are often times where the numbers are not necessarily being reported, so that's definitely one of the things that we're trying to encourage through the use of this vaccine administration increase, is both to have those one-on-one conversations that we heard from Secretary Key are so critical, but also to be able to make sure that as those vaccinations are happening, we're getting shots in the arms, we're getting those recorded, and helping to keep people safe.
Governor Hutchinson?
Do you not have numbers regarding Arkansas Works population vaccination?
We can get those. If you want to email Amy, we'll be happy to get those to you.
Governor Hutchinson?
Yes.
Yes, the White House today said you'd had a phone call about COVID-19 with President Biden. How did the call come about, and will Arkansas be receiving any additional federal assistance?
Well, thank you, Frank. And yes, yesterday I had a call from President Biden. There was not anything prearranged for that. He simply called me, and he applauded our efforts here in Arkansas. Thanked me for we talked quite a bit about the community COVID conversations and our town hall meetings. And then he did offer assistance. Now, he wants to be supportive just like he does with other states, but he knows the challenge that we face. And I told him we had currently the COVID surge team here in Arkansas making a report that I'd be reviewing. So it was a very congenial conversation. I did raise the issue about FDA approval, and I was encouraged that the President indicated that the FDA has indicated that they hope, I believe it's within 3 weeks, to have the final approval decision made. So it was a good conversation. I was grateful for his interest in Arkansas, and that he recognized all the work that we're doing under very difficult circumstances.
Hey, Governor, this is Mitch at Channel 4 and Fox. Baptist Health announced yesterday that it did not have any ICU beds available for most of the day. Based off of today's report, hospitalizations continue to increase. This morning, COVID.com reported only 1 COVID ICU bed available. What happens when that hits zero, when there are no ICU beds available across our state? And also, that ICU bed availability number, does that include locations like the VA?
No, the VA would be outside of that COVID-com mix, and you can correct me if I'm wrong, but I believe that is correct. And then, is that Renee over there? You might have to help me out here. Please come up here. I think you can add to this conversation, Renee. But in terms of the space, what happens is that you'll have an ambulance that will bring a COVID patient in, or some other medical emergency, and if they do not have ICU space, then they have to wait. And that's the problem, because you're, if an ambulance waits for 4 or 5 hours for a space to free up, then they can't respond to other emergencies. So all you can do is wait till a bed becomes available. Now, the hospitals are utilizing, if you want an ICU bed or if you want a medical capable bed for a COVID patient, they're going to take care of the patients, but there's wait time involved, and you can't always get that level of care that you would in an ICU. But Renee, can you come up here and answer that? Renee Mallory is our Chief of Staff of the Department of Health, who has worked on this consistently and has more specifics.
I think the governor did a great job of answering that question. We are working constantly. He referred to a couple of proposals that we had approved last Friday. We're in the process of getting those agreements signed, and so those hospitals can reach out and get staffing for those additional beds to be able to put patients in. We're working diligently and as quickly as we can to get extra beds available. We will continue to monitor the need for additional beds, and we have additional proposals, and we will look at those at the time that we feel we need additional beds, if that happens.
Let's just take one or two more questions if there are any.
Jumping off that question, Rosita Hogan with Action News 5 out of Memphis. Are there any conversations about transporting patients possibly to Memphis area hospitals, or do you know of any conversations happening around that?
Conversations about utilizing Memphis area hospitals?
Yeah, with the shortage of ICU beds in the state.
Well, and the answer is that, in the West Memphis area, that is one of the go-to hospitals. So I think that is continuing to be an option. Obviously, the bridge, when it was not repaired, caused a real problem with that, but now that it's operational, then that is absolutely an important option for Eastern Arkansas residents in that area. One final question. Andrew, you had one, I think, and then Michael.
Yeah, on the masks that you're trying to get for schools, do you have a cost estimate of how much it's going to cost for the state to get those, and what's the challenge in not being able to get those before school starts?
Well, and Johnny's really worked hard on that. And can you comment as to on the time frame, Secretary Key?
We've been working with Director A.J. Gary at Department of Emergency or Division of Emergency Management, and as far as the adult sizes, they have substantial quantities of masks available. The challenge is for the smaller sizes for the younger children, and since that's the population of students that do not have a vaccine available, the emphasis is to try to make those size masks. The supply chain is very limited with respect to that size. So that's the challenge right now. We have, in the previous ESSER funding under the state set aside, we have $500,000 left from some money that we had set aside specifically for PPE. We are looking at using those funds that are available, and we are still gathering the total prices. Obviously, we'll be working very hard to get those in and drop shipped either to the co-ops or directly to the schools by the time school starts on Monday.
Those one that we have in warehouse will get there before school starts.
Yes, yes.
Yeah, and just to add to that, we have ample supply in our warehouse of masks that are suitable for those older children, and so we can get those to the schools immediately. The others we will be having to get from the manufacturer, as Secretary Key said, to get those out. Mike, last question.
Have you decided who you're going to hire as outside legal counsel, and will that be financed out of the governor's budget, or do you have to ask for additional appropriation?
No, good question. No, that is would be out of our operational budget, so we have adequate budget for that out of the governor's office. And secondly, I have identified counsel. We're not prepared to announce it yet. Thank you.
There we go. Audio is working now. Apologize about that. Governor Asa Hutchinson delivering his COVID-19 briefing today. This while the state recorded 2,620 new COVID-19 cases over the last 24 hours. 1,435 are in the hospital right now. Those numbers continue to trickle up. Let's bring it up for you right here. Over the last 24 hours, there were more than 2,620 cases reported, where 562 new active cases in the state. We're looking at 59 additional hospitalizations. That brings us to 1,435, which, by the way, is yet another record. We're also learning of 24 additional deaths, bringing the state's total to 6,346. We did ask the governor today what happens when those ICU numbers, those ICU beds completely fill up. Today, we're learning, according to the governor, at this point, if a patient is taken to an ICU bed in an ambulance and that patient is in need of an ICU bed, that person will wait in an ambulance in the hospital parking lot. This is a situation that continues to just worsen across to Arkansas while those cases continue to increase. Hospitalizations also increasing overnight, again 59 additional. It's worth noting later today we will get an updated number from the Arkansas Department of Health in terms of how many ICU beds are available across the state of Arkansas. It's worth noting that early this morning, Arkansas COVID-Com, the state system responsible for transferring COVID-19 patients, reported that there was only one ICU bed available for a COVID patient across the state of Arkansas. That is the lowest number of beds available since this pandemic began. Late yesterday, you heard the governor say that there were 8. So that number continued to decrease overnight, and we went from 8 ICU beds to 1 ICU bed. The governor said that we've added a few more ICU beds just since late this morning. So we're going to continue to monitor that number. We will get an update from the Arkansas Department of Health within the next hour or so, and they will announce how many total ICU beds are available across the state. So when that number is released, we'll send it to your mobile phone through a push alert. If you have not already, download the KRK4 and the Fox 16 smartphone app. For now, I'm Mitch McCoy. This has been a special report from KRK4 and Fox 16. We will continue to update you both on air and online as those COVID numbers continue to trickle in. For now, this has been a special report from KRK4 and Fox 16. I'm Mitch McCoy. Have a good rest of your afternoon.